we're turning our attention to COVID-19. While all of us have become complacent, and I'll admit it, most of us have become complacent, it's feeling like things are going fine. Active new daily cases are reducing in India. We've had this miracle sort of recovery from COVID-19. Vaccinations are rolling out. But another example has come up over why you just can't take your foot off the pedal. And this time from Mumbai and from Maharashtra. Maharashtra COVID daily cases are back over 4,000 in a single day. That's the highest single day case number in 40 days. In Mumbai, it's back above 600 cases a day, which is the highest in a month, 31 days actually. Jan 14th was the last time when you had that many cases. So this spike is also coming at a time when Mumbai trains, Mumbai locals have opened up even more. And in fact, there have been quotes from the local government saying that they may have to take stringent measures if this continues. Dr. Shashank Joshi is joining us now to give us a perspective over what we're looking at. Dr. Joshi, great to have you back on the show. Give us a sense of why this is happening. Is it all just down to the local trains opening up?
No, Tamanna, I think there are serious issues here. Though I'm not so sure whether we are looking at a second wave. Three things are very clear-cut. The first thing is that from 20 lakh commuters in the local trains, we have gone up to 35 lakh commuters. But most of these people probably already have a large number of exposure. It is the non-exposed people who have started coming out. Opening up of schools and colleges, total lack of COVID-appropriate behavior, unmasking, that is what is the cause of concern. And also remember that what is serious about Maharashtra more than Mumbai. Today, Mumbai is down to 493 again. So, Mumbai has been fluctuating a lot between 350 and 550 in the last 2 to 3 weeks. And that could be attributed to be partly because of the full unlocking, compounded by a little bit of extra train traffic. But train traffic, if you add 15 lakh people per day, will contribute much more than what we anticipate. So I don't think that is the only cause of concern. But in Maharashtra, we had Gram Panchayat elections exactly similar to the local body elections which were held around 4 weeks back in Kerala. And both these states have beaten the trend across India. Now there are only 3-4 possibilities. Either total lack of community testing. So community testing needs to go up. We are only doing hospital-based testing, and there is lack of COVID inappropriate behavior, and also probably in Kerala there is a genomic mutation. In Maharashtra, in pockets like Vidarbha or places like Marathwada, there could be possibilities of genomic mutations. In Mumbai, Thane, it is still it's becoming endemic here, and we are having a thick tail. So the Mumbai's thick tail is back. What you said, 14 Jan to maybe 15. Yesterday was 14 to 14, 645 yesterday. Today 493. Clearly shows that our tail is still thick, and because we have a very population dense environment, overcrowding, a lack of ventilation, we need to get back our COVID appropriate behavior. Otherwise we need to be very strict on our masking. Otherwise we'll be back to square one, and I don't think we can afford a lockdown again. Yeah. So if we really need to be serious, and there might be some parts of Mumbai like mini wards which might get locked out again if we continue to go up on the trend and clock 1,000. Because most of these are coming from selective geographies and selective wards. Actually, Mumbai Municipal Corporation has come out that there are 3 or 4 wards which are the troubled red spots. So it is very likely that we may not have the whole city shut, but we might have small mini micro parts of the city which may get shut in a local regional way.
Okay, so those signs coming across, I'm just seeing what Ajit Pawar, Deputy Chief Minister of Maharashtra, also said, where he says if the situation worsens, we may need to pay a heavy cost for this carelessness, and we may have to take stringent measures again. Now, explain to us, Dr. Joshi, we often see whenever there are these regular bulletins that Maharashtra and Kerala account for over 70% of the COVID cases. Why is this happening? Anecdotally, and even if you see in the rest of the country, it's not as if great levels of precautions are being taken, in terms of masking and social distancing. I don't think anyone would say that that's the case, that Mumbai or Kerala and Maharashtra is being more careless or less careful than other parts of the country. So what do you see as the reason for high concentration of cases in these two states?
So that's exactly the reason which I said, Tamanna, earlier. 3 reasons are there. Number one, in Kerala, clearly there is a mutant strain. and they also had local state body elections. So a lot of people came into the rural hinterland. Same thing happened with Maharashtra. Exactly around 3 to 4 weeks back, we had Gram Panchayat elections. So these two are typical to both these geographies. I have a distinct feeling that in Kerala there is a mutant strain, and probably in some parts and heterogenetically some parts of Maharashtra also there is a mutant strain. Because you're absolutely right. It's not that COVID inappropriate behavior is not there in Bengal or Delhi or Uttar Pradesh. It's clearly not there too. But point is the population density of Mumbai is much more clustered, and in Kerala there is nothing like rural Kerala. It's all urban. So I think the clustering here is much, and the overcrowding and poorly ventilated environment is much more. In Delhi there is a larger space, so probably that is a different factor. But clearly there is probably a genomic variation. And the second reason probably is that we have completely unlocked now. So schools have opened up, colleges are opening up, trains have come back. So Bombay has a clear-cut reason and a rationale. But what has surprised us is places like Bhandara, Amravati, Nandurbar, Nanded, Wardha, Nagpur. These have been, suddenly seeing a large explosion of cases. Pune, which was reporting hardly 90 cases, is suddenly down to 330, which means there's a threefold rise in Pune. So clearly we are seeing that there is a surge which is happening. And also remember social gatherings, marriages which are occurring. People are flouting the norms which have been put down like 50 and 100. And people think COVID has gone away and unmasking has become a nature. I think also there is a pseudo confidence developed because vaccine is round the corner. And all these factors are actually detrimental as a yellow signal. I would not put a red signal right now. I'll put a yellow signal. But clearly we can see that is why you can see Maharashtra and Kerala beating the trend. Kerala is much more, like they have almost 60-70,000 cases compared to Maharashtra, which is around 35,000. And the whole rest of India, if you see, the next state is Karnataka, which is only at 5,000. So you can see that the difference is quite dramatic. And probably I think two factors. One is, of course, the local self-government elections, and probably a little bit of genomic variation. These two probably look to be the most possible reasons. Of course, another 2 weeks, we'll know the clear trend.
Now, this is also happening at the time when vaccines are a reality, Dr. Joshi. Whenever we've spoken in the past about cases spiking up, we've talked about maintaining social distancing, masking. We need to do that now as well. But you also have a vaccine rollout which has been taking place for the last several weeks. Why is there no relief coming from there, and do we need to now dramatically ramp up that rollout? Maybe pull in this private sector as well so that more and more people are vaccinated?
So I think that question is best addressed to Government of India. I don't think we have started. We have only done the first mile of the vaccine rollout, which is to the COVID healthcare workers. And now we have started frontline workers. The real vaccine rollout has to come in those 30 crore population. And we are nowhere near there. We are just finished maybe our first mile of 1 crore, in which are the healthcare workers, and we have started the frontline workers, which are 2 crores. Obviously, it needs to be ramped up. It needs, and maybe these two stretch which are beating the curve probably need to be given a priority by the central government in vaccinating those geographies faster and quicker, so that, because this can spread across the country. So we need to be very cautious and careful about it.
Absolutely. Thank you so much, Dr. Joshi, for joining us today and putting that into perspective. Just when you thought that it was all over, people are, and Dr. Joshi is right, people have sort of begun unmasking, have really thrown away their cares, and there's a feel-good factor that COVID is now over, it's done with. Remember, the vaccine rollout has only begun. There is a while before a large enough percentage of the population gets vaccinated. Let's not make a mistake. We're seeing the signs of carelessness already in Maharashtra and Kerala, including in Mumbai city. So let's be safe.